The role of the sterile processing technician is to perform all aspects of sterile processing functions with the basic surgical instruments in the healthcare workplace. The objective of the sterile processing technician program is to prepare students with the knowledge and skills needed to seek entry-level positions as sterile processing technicians in hospitals, medical centers, and other centralized medical facilities. I will introduce you to Kat LaRue, our program director, and she will walk you through the lab.
Okay, my name is Kat LaRue. I am the program director for both sterile processing and surgical technology. So we kind of run it just like we would a real OR, where we have surgeries and then we process the instrumentation, which is what the sterile processing department does. They'll pull cases, they will process instruments, they will put them back together, make sure everything is sterile and everything is running properly. So if I walk you around, just some basic things, you can see some of the basic equipment that you would find in a sterile processing department. One of the things that does make Fortis College a little bit different is all of the different things that we have that you can see and you can feel and you can learn how to identify. For example, I have tons of instruments in this lab, including specialty instruments that you wouldn't find in other areas. We also have, tabletop sterilizers, we have an ultrasonic cleaner, we have some sealers. If you walk along, we still have some more equipment and supplies along here. And as I was mentioning, we learn how to process and sterilize specialty instruments, so not just general instrumentation, for example, vascular sets, micro instrument sets. We teach you how to wrap and sterilize instruments as well as put the sets together, how to replace instruments on the sets if they are missing, as well as different methods of sterilization. We also teach you how to decontaminate instrumentation, which is what these sinks are and all of the chemicals are. So instruments that come back from surgery that are contaminated, we will clean them up, we will dry them off, we will use all of these chemicals and PPE to make sure that we're safe. We will take them then to the tables where they will be processed. So if you look along these edges, I have specialty instrument sets, like these big, huge bins, which are actually for the Da Vinci robot arms. So we do have several Da Vinci robot arms so that you can learn how to do the processing of specialty instrumentation, as well as laparoscopic things, as well as microscopic things. So we go from big to small, and we'll teach you how to wrap and label everything to make sure that everything has been sterilized properly, and then set up the instrument sets for use for the next day. So you can see we have all of our cleaning supplies, all of our packaging supplies, everything that we need to actually simulate an actual sterile processing department. So again, we definitely do have a lot to offer somebody who wants to come into sterile processing, and we do have a lot of specialty things that you may not find in other schools.
The surgical technology program is designed to prepare entry-level surgical technologists in the cognitive, psychomotor, and affective learning domains. Graduates are provided a strong background in surgical procedures to include such areas as general cardiac, neuro, plastic, orthopedic, vascular, GU, ophthalmic, and OBGYN surgical procedures. Again, I will introduce you to the program director for surgical technology, and she will walk you through her lab.
My name is Kat LaRue. Again, I'm the program director for both surgical technology and sterile processing. So this is the Surg Tech lab, and I apologize, we had a surgery in here earlier, so it's a little bit bloody. We do like to try to make it at least exciting. But if you glance around the room, you can kind of see all of the equipment and supplies that we do have here at Fortis College in Richmond. We have multiple back tables for the students to learn how to do a setup. We will actually go through multiple different types of setups, not only vascular, but neuro, genitourinary, all of the types of surgeries that the student will be exposed to on externship. The externship is done in an actual hospital in the OR under the auspice of a preceptor. Now, the preceptor is not going to scrub the case for the student, but they will be there for the student, help them through surgeries. At the end of the externship, the student will have done 500 hours on site in an OR, and they will have done a minimum of 120 actual surgical cases. So you're kind of getting all of the reality. So basically what we do in here is we do teach them how to do basic surgeries, and then also some specialty surgeries. And the specialty surgeries include the ones that I mentioned earlier. We have surgical simulators. I'm not going to take them down because she's been cut a few times. But we try to make it very realistic. We have intestines that will actually come out, and we can do actual resections. We can do Achilles tendons. We do AV fistulas, all sorts of different things. We have working OR lights, and we have a bovie that does actually work. It doesn't burn, but it does work. We also have suction. We have a couple of x-ray machines, and then of course we have extra things if we need to turn another room into an extra lab. We also have multiple surgical instrumentation sets, and every single student makes their own back table pack that they kind of keep track of. Just if you, again, look around, we have an anesthesia machine. We also have crash carts, other types of things. And a lot of the things that are in here are the things that you would find in a normal OR. We have, not only the equipment, but also the supplies that are in here for prepping, draping the patient, doing catheterization on the patient, monitoring the patient. All of those things are included in here, and they're found in different areas of the OR. We also have drills where the patient could crash, and we learn how to handle an emergency situation, like an emergency tracheotomy, or the patient stops breathing, things like that. They're always a lot of fun when we get to those points in the surgeries, and we generally have a very good time in here. This is one of my favorite places to be in the whole school.